not sure though.
You're not sure? Okay. Well, what are some symptoms that you feel that makes you feel like you're in labor?
Um, I think I'm having contractions, but it's just like a lot of pain.
Okay.
And that's about it.
That's it? Okay. So are your contractions like 5 to 1 where it's like they're lasting over an hour? They're like 5 minutes type thing? Are they like irregular? Or are they
Um, they're more irregular. They're probably maybe about 30 minutes apart.
okay? And with those, is like it increasing when you're walking?
No.
And have you taken any pain medication for them?
No, I haven't taken anything.
Okay. Well, sometimes with true labor, oftentimes you'll see like you'll have your contractions will be 5 to 1. You'll have cervical change, which will be a cervical exam, which you can also do here if you would like, where we kind of look at the trend between your cervix and kind of say, okay, well, it's changed in size, so there's a chance that you're obviously going into labor. Also, when you're walking, your contractions will get worse. The pain will increase a lot, So because you're not having that, and because, your contractions, even though between 30 minutes, that's kind of giving me like a little worry. We want to monitor it, but I don't think at this point that you're in true labor. But that can definitely change if we look and see any cervical changes during our cervical exam.
Okay.
Okay, so now that we're past that, I just want to ask you a few questions that I wrote down here on my notes. So, do you know how many weeks along you are?
No, I'm not exactly sure.
You're not exactly sure. All right, well, can you tell me the first day of your last period?
I believe it was June 9th of last year.
Okay. All right, so basically what I'm gonna do is math. There's a calculator built into the system, but basically we type in your first day of your last menstrual period, and so it subtracts 3 months, and then it adds 7 days. So basically looking at our computer and our system is telling me that you're 38 weeks pregnant.
Oh, wow.
Okay. So, during these 38 weeks, have you received any prenatal care?
No, I haven't.
None? Okay.
No.
Did you know you were pregnant during this time? Like, did you have any kind of
I mean, of course I knew I was pregnant. My belly was getting big, but it wasn't planned or anything. So, and this is my first pregnancy. So.
It's your first pregnancy. Okay. And so, and saying it's your first pregnancy, understand like you're full term, but have you had any abortions or miscarriages before?
No.
No. Okay. And being that this is your first pregnancy, we often want our patients to kind of have the best support system that they possibly can. Is there anyone that you have told about your pregnancy?
I told a few friends. I haven't told my family or the baby's dad. So,
Okay.
Yeah.
And how does that make you feel?
I mean, of course it doesn't make me feel good. I don't really feel like I'm prepared when the baby comes, and now she told me I'm 38 weeks. I feel like that's pretty close to, having the baby. So I really don't know what I'm gonna do with the baby.
Okay. And that's exactly what we're here for. At times like this, oftentimes we have patients varying. Some patients have a complete support system behind them, and some don't have anyone. And right now, I can obviously tell you're tense and you're scared, and you're 2 weeks from your full due date. But we're gonna be here for you. Here at our patient care, we act as a family. We're gonna be behind you. We're gonna be making sure that this process is smooth for you as possible as we can. I can't say it's gonna be full sailing ahead because every pregnancy is different, but we're gonna be here, okay?
Okay.
All right. So keep in mind with that, because this wasn't planned. I don't want to assume, but do you have a birth plan?
I haven't really thought about it, honestly.
Okay. Well, that's something we definitely gonna have to do soon. This consists of an epidural, like if you want one, if you don't want one, if you want a wire birth, if you want to have one laying down in bed, your positions, everything that consists of a birth that you would want that will make you happy, that will help relax you and relieve some anxiety and stress off of you. That's basically what birth plan is. And that also helps us to be that family for you, okay? All right, and so I have a few more questions left here, I think, and we're gonna be, so I know that you've kind of been stressed lately. Can you tell me if you have any medical or surgical history that might possibly be affecting?
Well, I had my boobs done about 2 years ago.
Okay.
I also have anxiety, which I take meds. I take 2 meds for that. I don't smoke. I don't drink. Yeah, and I don't use any like over-the-counter meds or anything.
Okay. All right. Well. All right. So you basically answered all my questions so far. I'm just again looking, charting, making sure that I have everything. Well, our next step is to kind of just see what you're comfortable with. Again, checking most likely your cervix to make sure there's no changes and that you're not truly in active labor. And if you are, we're just gonna move together as a unit, okay? I'm gonna be with you through this whole entire process. You have nothing to worry about.
Okay.
All right. Thank you.